well seen on transabdominal ultrasound. A full bladder can act as an acoustic window to scan other pelvic structures when using the transabdominal approach. Patients should be instructed to hold their urine prior to the exam. Fasting before the exam is recommended whenever possible. This will aid in decreasing the amount of bowel gas shadows, which can drastically decrease the quality of images. As a starting point for the examination, the patient should be lying supine on the examination table. Place a sheet to cover the patient below the level of the pubic symphysis. To obtain a transverse view of the bladder, position the probe so that the probe marker is pointing toward the patient's right. The urinary bladder is a pelvic organ, so the transducer must be positioned just superior to the pubic symphysis and aimed into the pelvic cavity. In the transverse view, scan the bladder from the proximal to distal end. Obtain a mid-transverse image where the width of the bladder appears to be at a maximum. The bladder wall should be smooth with no mass protruding into the lumen of the bladder. Measure and document the transverse dimension. Activate color Doppler mode or power Doppler mode and use the trackball to move the color box to the region of the ureterovesical junctions. While observing the bladder of a well-hydrated patient, you will be able to see ureteral jets of urine in the lumen of the bladder. To obtain a longitudinal view of the bladder, position the probe so that the probe marker is pointing toward the patient's head. Obtain a mid-longitudinal image where the height and antero-posterior dimensions of the bladder appear to be at a maximum. Measure and document the longitudinal and antero-posterior dimensions. The volume of urine can be calculated by multiplying the 3 dimensions of the urinary bladder with a correction factor of 0.52.